Hello, my name is Dr. Bill Orison. I'm the Chief Medical Officer of RadSite, the Medical Director of Nevada Imaging Centers, Clinical Professor at the University of Nevada School of Medicine, and Professor at the University of Nevada, Las Vegas Health Physics and Diagnostic Sciences program. Today we're going to talk about patient safety in medical imaging. The National Council on Radiation Protection and Measurements has indicated that the United States population exposure to medical radiation is increasing dramatically. The U.S. population is now exposed to six-fold increased medical radiation as compared to 1980 levels, and the annual per capita exposure has also gone up dramatically, and the collective population exposure is increasing as well. CT now accounts for approximately 12% of all medical radiation studies and as much as 45% of all radiation dose. In 2004, medical x-rays were listed for the first time as a human carcinogen. X-ray radiation and gamma radiation are known to be human carcinogens, and they are now formally listed as human carcinogenic agents. If you don't remember anything else from this lecture, probably the most important slide is the one we're looking at now. This slide describes the lifetime fatal cancer risks from radiation exposure. And please note that women have a greater risk than men, and that children have a significantly greater risk than older individuals. As we age, our risk goes down, and the younger the individual, the greater the risk from any dose of radiation. The cancer risk from screening CT examinations can vary dramatically. This particular study, performed and published in July of 2009, shows more than a 10-fold variation in radiation doses from coronary artery calcium screening with multi-detector CT scans, concluding that there's a variation in the estimated radiation-induced cancer risk depending on the examination that is performed and the way that the study is completed. The chest X-ray is the most frequent study performed in the United States in terms of X-rays. There are about 150 million chest X-rays performed in the United States annually. That's 4 chest X-rays per second at an annual cost of approximately $11 billion. And most of us don't worry too much about a single chest X-ray. However, there can be significant risk from even a single chest X-ray, particularly if you are genetically positive for breast cancer. Women who carry the genetic factors to make them more at risk for breast cancer will have an increased risk of breast cancer from even a single chest X-ray. For example, exposure to a single chest X-ray in a woman before the age of 20 indicates a possible increase as much as 2.5 times in their risk factor of developing breast cancer before the age of 40. So if you're under the age of 20 and you have these genetic risk factors and you have a single chest X-ray, it can increase your risk of getting breast cancer 2.5 times before you reach the age of 40, which is not insignificant. In this study looking at scoliosis examinations in women under the age of 20, a study was conducted of 5,466 women who had a scoliosis exam before they reached the age of 20. Now, some of these individuals had only a physical examination, so they didn't receive any X-rays. Other individuals had multiple X-rays performed. The average follow-up was 40.1 years. And the average number of exams was 24.7, meaning that the average number of these women had more than one examination per year during that time frame. And the findings from the results relative to their incidence of breast cancer is rather striking. In this study, they found that there was a direct relationship between the amount of radiation that the individual received and their risk of developing breast cancer later in life. So there's a direct proportion between the radiation exposure in childhood and the associated increased breast cancer risk later in life. The universally accepted principle for limiting radiation dose is to keep radiation exposure as low as reasonably achievable, the ALAR principle. This is the standard principle. It's used throughout the world. The idea is that in any way that you can reduce radiation to individuals, you do so because we know that radiation has risk associated with it, particularly risks of cancer. Many people worry about cellular telephones, exposure to high-tension wires, the use of hair dyes, exposure to different types of compounds, or other nutritional factors. But the only true risk factor of brain tumors is the use of ionizing radiation. ionizing radiation is the only unequivocal risk factor that has been identified for glial and meningeal neoplasms or brain tumors. Irradiation of the cranium, even at low doses, can increase the incidence of meningiomas by a factor of 10 and the incidence of glial tumors by a factor of 3 to 7, with latency periods that go out as long as 20 years or more. There's no other environmental exposure or behavior has been clearly identified as a risk factor. So when we're concerned about things that can cause brain tumors, like cell phones for example, the only thing that's really been proven to do so is low-dose radiation. Now this is a 53-year-old woman who came into our facility with a history of chronic headaches, and she had an MRI scan. At the time she had the MRI scan, my technologists asked me to come check the scan because they saw something that they thought was unusual and they were concerned about being a brain tumor. I checked the scan and indeed found this lesion that you can see on this patient in the center of the brain that looks, and it does turn out to be a brain tumor. At the time that she had this examination performed, I actually talked to her when she came out of the scanner, and I asked her one question. I said, "Did you have radiation as a child?" And she said, "Interesting that you should ask me that. When I was 5 years old, I was treated with radiation to both of my ears for chronic ear infections." So she had radiation directed through each of her ears directly toward her ear canals for chronic ear infections. And the overlap point of that radiation would be basically right in the middle of her brain, right between her ears, which is exactly where this brain tumor has occurred. I don't think personally that's coincidental that that happened. I think we're looking at a radiation-induced brain tumor. Low doses of ionizing radiation in childhood can result in cognitive decline. There's a study that demonstrated a significant decreasing probability of attending high school in relation to radiation dose that occurred during infancy. So that irradiation of the brain with low dose levels overlapping those imparted by computed tomography can, at least in some instances, adversely affect intellectual development. So again, we want to control radiation for a lot of reasons, and one of them is that we want to avoid damaging the brain. CT is probably the largest cause of the radiation that we see in medical imaging today. It accounts for at least 10% of all imaging studies. As I indicated previously, it's at least 45%, and in this study, 67% of all imaging radiation. And we know that lots of patients have more than one scan. In this study, 30% of patients had 3 or more, 7% of patients had 5 or more, and 4% had 9 or more. Typically when I give this lecture, it's not uncommon for there to be radiology technologists in the audience, and I've had those individuals raise their hand at this point and say, "By the way, I've seen a lot higher doses than that, a lot more radiation than that." Patients who come into the emergency room, for example, who are being followed for renal stones, may have many more scans than this performed in a very short period of time. So one of the things that we have to be careful about is the fact that some of our patients get scanned repeatedly, and we don't want them to get so many scans that it becomes dangerous to them. We know that there's a dramatic increase in the use of CT scan in the United States. In 1981, there were roughly 3 million examinations performed. In 2006, there were over 60 million, and today there are approaching 70 million scans per year being performed in the United States. It's now estimated that 1.5% to 2% of all cancers in the United States may be attributable to the radiation from CT by adjusting for current CT use. So it's possible that as many as 2% of the cancers that we see in the United States today are caused by CT examinations. Why are we doing so many CT scans? Well, around the year 2000, it became very popular to do screening CT scans in patients, even for patients to come in and get scans performed as just a screening procedure for themselves for cancer. This is a headline from the USA Today, "Want a CAT scan? Step right up." This was from May 25th, 2000. At about that same time, in 2002, as reported in the American Journal of Röntgenology, a show appeared on the Oprah Winfrey show, had a segment where Oprah had a CT scan performed. And it was actually have a videotape of the show. It was an excellent show. As most of Oprah's work is, it demonstrated very, very nicely the benefits of CT, advantages that CT has in showing exquisite anatomic definition and actually screening for cancer. Unfortunately, an individual, a physician on that show, indicated that the whole body CT scan that Oprah had was equivalent to one chest x-ray. That's off by an order of magnitude, as we'll see. But that TV show also, as has been reported in the medical literature, heralded the new age of entrepreneurial CT scan centers and helped fuel the growth of self-referral by healthy individuals for CTs and caused a lot of individuals to request CT scans from their physicians. In July of 2002, Popular Mechanics ran an article on this technology and indicated that the whole body screening CT that's performed had an equivalent of approximately 200 chest x-rays, and that the cardiac scans that they were specifically addressing had chest x-ray equivalents of approximately 2. These again are off by a more order of magnitude. The whole body screening is actually equivalent to approximately 2,000 chest x-rays, and the cardiac screening is approximately 200 chest x-rays. So you can say, well, how could these popular media be so far off? How could they misjudge this so much? Well, unfortunately, it's not just the popular media. This is a study done at a major medical center in the United States, looking at the assessment of patient, physician, and radiologist awareness of radiation dose and possible risks. And this was a survey of patients, of emergency department physicians, and radiologists. And this study basically showed that patients, emergency department physicians, and radiologists were all, for the most part, unable to provide an accurate estimate of the dose for one CT scan compared to that for a chest radiograph. So it's difficult to criticize the popular media if our own scientific community and our own major radiology departments in the United States are unaware of these risks. And in fact, in this study, less than half of the radiologists reported that a CT scan could increase the lifetime cancer risk of a patient. Only 13% of radiologists could accurately estimate the chest x-ray equivalence of a CT scan. So if individuals who are professionally involved in this have this much difficulty, it's not hard to understand why the lay press would have difficulty with that. And interestingly, the years of experience made no statistically significant difference in the estimates of radiologists or emergent department physicians. So that it didn't matter whether you'd been out in practice for a very long time, as I have, or whether you just came out of training. The individuals didn't perform any better. So what that tells us is that we're not doing a very good job of educating our physicians early on, and we're not doing a good job of educating people as they continue to work in the field of radiology in the area of radiation risk. Now I'll show you some statistics in a few moments that show that we're making some progress. We are getting better, but we still have quite a ways to go.